Hi, this is Dr. Dean Kelaita, Health Officer for Calaveras with a COVID-19 update for today, July 14th, 2020. Just like national and statewide numbers, COVID-19 case counts in Calaveras County continue to rise and escalate, in fact. Calaveras has recorded a 40% increase in COVID-19 cases just since the beginning of July in the last 2 weeks. California as a state has recorded 329,162 cases, now with an average of over 8,000 cases being reported on a daily basis. Southern California remains hardest hit, with a significant increase in cases in the Los Angeles area, and also in Northern California in San Quentin Prison near San Francisco, which is actually fueling and seeding outbreaks in Northern California as well. Hospitalizations and ICU admissions in Southern California in multiple areas are becoming very significant and impacting the care for patients in those hospitals. And many of those patients have required transfer from those hospitals in Southern California to hospitals in Northern California in the San Francisco Bay Area to accommodate the surge in new patients requiring hospitalization for COVID-19 illness. Very critically ill patients. There have been 7,040 deaths in California as of today. The numbers in Calaveras County are that we've had 67 total cases so far reported in Calaveras County residents. 45 of those cases are considered active and 22 cases are recovered. There's currently one hospitalized patient and no deaths reported as of yet. There have been 9 total hospitalizations of our total cases in Calaveras County, which is 13.4% of our cases. And that matches pretty national statistics between 10 and 15% of patients will require hospitalization. Our county is averaging 73 tests per day, about at our goal that we've set for 150 tests per 100,000 population. That's one of the state's metrics for grading us. Calaveras has tested 3,196 residents for COVID-19 infection with the nasal PCR test, and that's a positivity rate of 4%. This positivity rate has doubled since the start of July. It still remains below the state's goal for counties of 8%. But a doubling of our percent of positivity of testing is significant. Hospital bed, ICU space, and capacity remain stable in our local hospital system. And Avalon Skilled Nursing Facility in San Andreas has had no staff or residents test positive for the virus. Employees of the facility are now being tested monthly as a surveillance system and precautionary measure to prevent an outbreak in our nursing home. And as we've talked about before, outbreaks in nursing homes contribute to a significant percentage of the deaths that we've seen throughout California and nationwide. On Monday, July 13th, Governor Newsom announced the statewide closure of the following businesses and business sectors because of the increasing statewide prevalence of COVID-19 cases, hospitalizations, and intensive care unit admissions. So these are going to affect Calaveras County as well as all other counties as well in California. All brew pubs, breweries, bars, and pubs, both indoor and outdoor. Dine-in restaurant services indoors has been suspended. Wineries and tasting rooms, indoor again. These are all indoor sectors now. Family entertainment centers, that would include bowling alleys, video game arcades, movie theaters, zoos and museums, and card rooms. I don't know if we have any card rooms in Calaveras, but if we do, they're on the list to be closed at this time. In an effort to access to assess the severity of disease in counties, the state maintains what they call a monitoring process, which is comprised of 6 different metrics that measure the severity of COVID-19. Counties that fall outside of these metrics for greater than 3 consecutive days are placed on the county monitoring list that's maintained by the state of California and are subject to additional social and economic restrictions. So these measures, these 6 metrics are: number 1, the average number of tests run per day in our residents, in our community. Number 2, the case rate, which is defined as the number of cases per 100,000 population. Number 3 is the testing positivity rate, which I talked about, where we're at 4%. Number 4 is the increase in hospitalizations. And 5 is the availability of ICU space. And 6 is what's called ventilator capacity. That's how many of the machines we have available in the hospital to help with people needing breathing assistance. Calaveras County is not on the monitoring list at this time. We're getting close in a few of those measures that I talked about, and we're experiencing some increasing case rates and increasing test positivity rates. And so we're bumping up on a couple of those measures, and we'll have to keep a close eye on those. For counties that are on the state monitoring list, the following additional measures are being imposed upon them. Closing for at least 3 days of indoor operations for certain sectors that promote the mixing of populations beyond households and make adherence to physical distancing, even with the wearing of a mask or face covering, more difficult. So for counties that get put on the watch list, they have additional closures of the following sectors: gyms and fitness centers, places of worship, that would include churches, mosques, synagogues, indoor services, protests, offices for non-critical infrastructure sectors, identified at our website, covid19.ca.gov. Personal care services, including nail salons, massage parlors, and tattoo parlors. Hair salons and barber shops, that's one that people have had difficulty with in the past, having been closed, and indoor malls as well. My goal as health officer for Calaveras County is to keep our residents safe during this pandemic, of course, protect the health and safety of our community, and to avoid us falling onto this statewide county monitoring list. So how do we do that? How do we keep from falling onto that monitoring list? Well, it's basic science. The best ways to avoid exposure to the virus are the following. They're messages that we've heard before and I've talked about before. Stay at least 6 feet away from people outside of your household. Wash your hands often with soap and water for at least 20 seconds. That can include hand sanitizer solutions that are available at stores. Avoid touching your eyes, nose, and mouth with unwashed hands, and to wear a face covering over your nose and mouth anytime you're outside and you're around others. That's an important one. It's overlooked often. It doesn't take the place of physical distancing, but wearing a face covering is very important. And for some reason, wearing a face covering has become a political issue for some residents. Now, the virus doesn't care about politics. It only understands science and its own biology. That's all the virus is interested in. Now, the good news is that we understand this biology. We understand as humans and as epidemiologists, we understand the science. Wearing a face covering is an important tool to fight and keep coronavirus in check. Preventing further infections not only keeps us healthier and reduces the risk of overwhelming our local hospital system and our very limited ICU capability, but it's also critical in preventing us from suffering further business closures and economic impacts, and will allow us to reopen all businesses and get our kids back to school as well. So those issues for things people can do, including wearing a face covering, are critical. Now, so is testing. Testing is recommended for all symptomatic persons, especially those who are at high risk, or contacts to for those contacts who are at high risk. Remember, high-risk people are the older people and people with chronic health problems. Those people who are exposed to a known or suspected case of COVID-19 should definitely get tested. Healthcare workers need to be tested and on a regular basis. Essential workers are important to get tested. Anyone desiring a test at this point, we feel we can accommodate here in Calaveras County. No-cost testing is available at the OptumServe Testing Center. That's located at the Calaveras Fairgrounds, Frogtown, in Angels Camp. Now the site is open Tuesday through Saturday now, from 7 a.m. to 7 p.m. We've expanded the hours. Appointments can be made by visiting the website or by calling the toll-free 800 number that's on our Public Health Department website for people to access. So you can log on to the website, you can make an appointment, they'll give you a date and time, or you can call the toll-free number to make an appointment. But testing, I also want to emphasize, in addition to face coverings, is one of the tools in our toolbox that allows us to better understand the incidence and epidemiology of COVID-19 in our community, to find people who've been positive, who've been exposed, who are contagious to others, to get those people on isolation, to understand everyone that they've been in contact with through what's called contact tracing that the Public Health Department performs, and to get those people tested and under quarantine until such time that we know that they're not going to contract and spread the illness to other people as well. This is good old-fashioned public health gumshoe case investigation activities, and it's one of the hallmark activities to prevent COVID-19 infection from perpetuating in our community. So those things that we do as a community today will help ensure that the rates of disease don't continue to go up, we don't face additional business and economic closures, and we can start to relax some of the new restrictions that have been imposed upon us from the state. So we need everybody pulling together, and we can keep this contagion at bay until such time that a vaccine or other drug therapy becomes available, so that we can start to get our lives back to normal again and start to resume the things that we've enjoyed doing historically as people that live here in Calaveras County. So thank you for your support, and further information will be released by the Health Department as we have it available. Thank you.